Three, two, one. Welcome back to another topic of AT Talks. This is topic 2. Is that me making all that wiggling noise? No? All right. We're talking about burnout today. And we're going to try to keep it more positive. We're going to talk about, first off, if we've ever experienced burnout, and then what do you do to prevent it, and what do you do to get out of the hole? So today we're with Spencer, and we're with Leah. Leah also made our awesome infographics for the AT Talks page, and then for the burnout, she's the scissors. That was her. So go ahead. The floor is yours.
So I lost in nose goes. Definitely can say that I've experienced burnout, especially in my current role where I have 30 million hats I'm wearing. I'm the sports information director as well as like a social media person and a game day operations manager. So it just ends up being a really, really long day for me most of the time. As for things that help me pull myself kind of out of a hole when I am starting to feel burnt out is confiding in my partner. So my husband does a very great job at listening to me when I kind of just need a vent about how frustrated I am or how long of a day I've had. And then as well, finding activities that I enjoy. So I like weight training, so I will set aside time every day or every other day to try to get in the weight room and enjoy it. So, but I'm also a young person, so I don't have very much experience. So I'm still in the process of learning that aspect.
So I think that's interesting what you talked about with having multiple hats. Do you get compensated for that extra work?
That is a conversation that if I don't want to lose my job, I probably shouldn't talk about.
I mean, it's okay to say no. Yeah.
No, the way that my contract was set up, it was under one item, and then it kind of got adjusted under the radar, and like there was a lot of very vague statements in there, so I get a lot of pushback if I say no.
Other duties assigned by supervisor. Classic.
Yep. And even though I have every right to say no, they kind of like guilt trip me into saying yes. And so then it just like kind of sucks. Like honestly, the position I'm in now is probably not something that I'm going to sustain being in, just because of how many responsibilities there are. Like I'm updating our website every other day. I'm so far behind in athletic training documentation because I have to constantly work on X, Y, and Z that is required. So like our men's basketball team is in the process of making playoffs. So I'm submitting rosters and documentation for them just to get to postseason. So like I haven't even logged into sportswear in like 2 days. So
do you feel like all those extra responsibilities just makes you feel like you're not valued?
Absolutely.
And then that just kind of leads you down the path of feeling burned out?
I would definitely say it definitely does make me not feel valued. But I think what makes it worse is that, like, for example, I'm not a graphic designer. I'm not someone who knows how to use Illustrator and Photoshop like the back of my hand. And I'm looking at YouTube videos to try to figure out how to use Photoshop and how to crop something appropriately or whatever and whatnot. So when I'm producing new content and there's like a lot of like negative kickback from it, and I'm like, I just put 10 hours into making this one picture and you hate it. Like, or when I get something like demanded on me, like, hey, I need this done in 2 hours. And I'm like, I have 3 people coming in for rehab in 20 minutes. Like, what? And
yeah,
so it's just,
go ahead.
It just is frustrating. And it definitely like, increases like anxiety.
Mhm.
And like, I'm not a person who's ever had anxiety, like pretty aggressively. Like I've always had like some sort of anxiety,
Mhm.
but it's definitely exacerbated with all
Yeah.
those other responsibilities.
Yeah, when I did my burnout talk with Bryce, I felt in the fall that when I was feeling the burnout, it was like a lot of it was psychological, mental, where I just didn't feel impactful. I didn't feel like I brought a lot of value to the table because I was so focused in on this is bad, this is bad, this is bad, that I couldn't step back and see all the good we were doing. So,
I mean, everything you guys are talking about is consistent with what the literature finds to be the major contributors to burnout, which are lack of social support in the form of like an employer, mentorship, both of those. Like it sounds like Leah has her husband as social support, but in terms of like the job that she spends probably 60 hours a week at, it doesn't sound like there's anything. So that's like the number one. And then work incongruence. So you sign a 40-hour contract and then you show up and they say, just kidding, you get to work 33% more hours or more than that. That's the number two. And then the third one is like stress management in the form of and almost a result of the other two factors, right? Like her employer has now set her up for failure by not allowing an opportunity to reward her for taking care of herself as an investment in the company that is employing her. Like it's just it's like this cyclical monster that and I'm not trying to be negative, like that is why I am so passionate about this profession, is because I care more about athletic trainers than I do the patients. Sorry. But as a result, you know, if we can fix the problems that plague our profession, we inherently improve the outcomes and the quality of care that the patients are receiving. And it's not that you're providing poor care, but you're being put into a system that doesn't allow for that. Like you just said, you have 3 people coming in, but another job gets tossed onto you. You're an athletic trainer.
Yeah. I feel like a lot of young professionals, they'll take that and they can't see through all that stuff that you just explained, and it becomes more of a reflection of themselves. And all of a sudden now you're thinking, maybe I'm not very good at athletic training, or maybe I'm not very impactful, or I don't have a lot of value. But it's not you. It's just what you've been thrown into.
The actual system that we perpetuate.
Mm-hmm.
And I think there's multiple prongs in which we can attack that. And it's super, super hard being a young professional with less than 5 years of experience, like, because there's this like impending fear of I'm going to lose my job. However,
it's so funny because you guys are hitting the nail on the head, because I remember last year was my first year in this current position, and I can definitely say so I don't have spring sports. So that's how they like kind of like get me. I'll work 80 hours in the fall with my 4 out of my 6 sports in the fall. Then, work 60 hours in the winter. And then the springtime, because there's no sports, I'm working 20 hours. So it equates out to like 40 hours in the year or whatever.
Does it? Have you seen the math on that?
It doesn't. But that's where that's the justification. But I remember being so like burnt out last year that I didn't even want to step a foot on campus for 2 weeks. Like, I just wanted nothing to do with the place. And like, I remember talking, like, he was my fiance at the time, but I remember like talking to him every single day about how like I just feel like I'm not cut out for the job, like that I'm a crappy AT or something like that, because like I shouldn't be this upset about something that I enjoy doing. And
yeah,
like
right.
so crazy.
So what do we do to combat those feelings and to try to turn it around?
My first question is understanding, and it's a different answer for everybody, but what happens when you say no? Mm-hmm. What happens?
A negative outcome.
What is that negative outcome? how do we, like, what is that quantified as?
I feel like it's more of our negative affliction to the negative outcome. Like, we say no, someone gets mad at us. We take that personally because we want to help everybody and we barely want to say no anyways. So.
But if somebody asks you to be a media director, all hypothetical, and you say, no, my primary role is as the licensed athletic trainer, even though you're in California, so
yeah,
as the athletic trainer, what is the hypothetical outcome of saying no in that situation?
Obviously, you resort to thinking, like, worst case scenario, oh, they'll just find somebody else that wants to do it, or you're going to lose your job because they can't afford to pay somebody for it, or you're not helping the athletes. Like, that's my biggest drawback when I try to, like, when I say no, I'm like realizing that we're not giving the kids the experience that they want, or the kids the experience that they deserve. So that's why I tend to not say no too much.
What do you mean the experience that they deserve? Elaborate on that.
So, like, for example, before I got here, the teams didn't really, like, have headshots up. They also didn't do, like, taking pictures in front of, like, a white backdrop for social media and stuff like that. So they don't get the fun stuff associated with it. Or, like, their athletics banquet was, like, thrown together like a high school. Like, they got pizza and handed out pieces of paper for participation.
Because I know it's hard, and especially with you in California, it is extremely difficult, because to say no to those jobs, those extra hats, like, I totally get that those are providing awesome experiences for the athletes, but your primary purpose is to be that healthcare provider on site. And I think your primary focus needs to be dedicated toward working toward documentation, because that's not just like a thing that you have to do. Like, that's somebody sues you, like, you're screwed. But it's also within 24 hours is the gold standard for documentation, according to, trying to remember the acronym here. I'm terrible. I'm not on my game right now, but.
And I can tell you a lot of people aren't even close to anywhere near that 24 hours.
Right.
I'm not.
But if I can find that, I'm going to make a note to myself. If I can find that, that's like a federal thing. Documentation guidelines. But I think if we identify the flaws in the care that you're providing, what that does is that opens up your opportunities to say, all right, I need to step back. I need to reframe the way I'm serving the patients as an athletic trainer, and really maximizing your ability and your time. So, like, for that role. So instead of cramming in 3 people in 20 minutes or whatever direction that scenario you mentioned earlier would go, trying to figure out, if I have 3 people, each one might, depending on what it is, if it's a new eval, maybe 60 minutes. If it's a rehab, 30 minutes, 40 minutes. If it's a follow-up assessment, 45 minutes, and really trying to allocate time in that regard, and creating like a time flow that demonstrates, hey, I'm providing 40 hours of patient care now, so I'm doing my job as an athletic trainer. And if they try to say, the contract with the word is another thing, that's a whole nother problem. But, if they try to say something there, be like, I mean, you can fire me, but then you're going to have all sorts of liability issues, because now the student athletes, the patients, will not be getting the healthcare that they're entitled to. So if someone gets hurt and then another athletic trainer comes and is put back into a failing system, then it's well within your right to educate the athletes, the patients, on what their rights are. If they're not provided the healthcare that they're entitled to, rise up, boys.
Yeah, but I'm sure that Leah has done uh, countless education over and over and over again to try to right that ship. And I'm sure
Do
she's doing
you
everything she can.
so we talked about your employer not having mentorship. Do you connect with other athletic trainers like in that region?
Yeah, so I have a couple of colleagues up in the Sacramento area that I reach out to, especially if I'm having difficulty. I've actually reached out to Tom um, regarding a huge liability issue that presented a couple weeks ago, um, which was super frustrating, but it helped me like segue into an appropriate conversation. Because they were trying to add an additional responsibility on top of that was almost erroneous, to be honest. They wanted me to provide coverage for a tournament that the high school on our campus was hosting, and I'm not affiliated with them. So they wanted me to provide coverage, and I didn't have like consent forms and a whole bunch of other just,
Yeah.
just thinking about this frustrates me. And like, I brought in like copious amounts of like documentation saying like, hey, I can't do this. I can't do that. Hold on a second. What's up?
Real quick question.
We'll never know what the question is. So Spencer, what do you like to do to try to, I don't know, stay positive and be happy and rejuvenate and refresh besides walking your dog?
Love walk my dog. She's chewing a bully stick right now. So for a period of time, I was not in a great situation, like mentally, and I wasn't prioritizing myself. I was getting lost in my schoolwork, my doctorate work. I was getting lost in committing to too many projects outside of work or like in addition to work. And I was just not doing well. I was like borderline functional alcoholic, like not exercising. And I like committed to going back in the gym. So going back to the gym 3 to 4 times a week. But I think the best thing that I ever did was I took the gamble of saying no when I was asked to do something. And that kind of like opened this little like crease in the door, like little doorway. Like imagine what a door, it's nighttime and someone shines a light through it. To like open that little bit of the door that allowed me to just continuously say, no, no, no. It's like prioritize what I needed to do for myself so I could function at the highest level. Like I'm functioning at a much higher level now than if you had talked to me 6 months ago. I wouldn't even be sitting here. I'd be like sitting on my sofa staring at a wall going, man, I could go for another White Claw right now.
I think another thing that people overlook is just getting enough sleep, getting a consistent sleep, like a sleep schedule. Where if you're in high school sports, I mean, you may get home at 6, you might get home at 9, you might get home at 11, and you never know if you have morning events. So we sleep all over the place. And I found that really took a toll on me because I wasn't going to bed consistency, and I wasn't waking up at the same time consistently. I just felt tired always. I would highly recommend that as well.
Yeah, I agree. I just started a new role in January where like at those 3 sites I talked about, and my workday kind of starts, it varies between 7 a.m. and 4 a.m. And so what I've done is it's much better than my previous job. Let me just leave it there. It was something to adapt to, but making sure that I go to bed at an appropriate time to get between 7 and 8 hours of sleep has really affected my mental health in terms of like waking up at the start of the day and saying, all right, time to go. Because before I would try and like hit snooze and say, I could just let my dog out and let her pee in the yard and things will be fine. But now we walk 3 miles a day because we walk at least 5 miles a day, but we walk like 3 miles in the morning because I get out of bed at a time that allows me to, except for on Wednesdays when I got to wake up at 3, but that's different. But sleep is VV important. It's the best supplement.
And I even recommend people, I'm like, if you don't sleep well, try a sleep aid. Try the melatonin or the ZQuil non-medicine version for sleep.
I have had trouble with melatonin. I would recommend really low doses. That's actually like the literature says, like 2 milligrams, not grams, 2 milligrams is like optimal for maintaining a good circadian rhythm without like getting your brain to stop producing the hormones. But I've taken like 10 milligrams before and it just ruins my next day. I wake up and it's like I drank a 15 pack of beer and I'm
like you're groggy.
So being careful.
And limiting the amount of caffeine that you drink late in the afternoon.
Hey, you don't tell me what to do.
No, I my whole day is stimulant based. Pre-workout stimulant. That's how I get through.
At what point do we switch to drugs? I'm just kidding.
I won't even lie. I'll show you right now. I take 2 workout products. One's called Total War and one's called Big Noise. And my kids call it my go-go juice. So I'll be like,
this is my go-go juice. That's what I call it.
Like I need some go-go juice and I'm just like, brrr.
I make my own.
See, I just use coffee and I call it life juice.
What?
Yep. Coffee is the flavor.
Sometimes you just have to hunker down and get through for a few weeks. So that's when all that caffeine comes in. All right. Is there anything else we want to add to the topic of burnout? What do we do to try to prevent it and get out of the hole?
Leah was telling a story.
Okay. Let's finish that story.
What I was talking about.
Crap.
Okay. Story for next time. Thanks for coming on, guys.
I think we were talking about colleagues. Maybe.
Something about a high school and presenting stuff.
Yeah. Copious amounts of information.
Yeah.
No consent letters.
Oh.
Sounds like a fun story for next time.
Because you walked in. Yeah. So I actually was demanded to provide services.
Hold on. Do you want this on the recording, or do you want me to end the recording and we can talk about this?
We could probably end the recording.
All right. Well, thanks for coming on for topic 2. Don't go because we're going to talk more, and there's going to be future topics, and we're going to have you back. So thank you for coming on for Burnout today. I appreciate it.